Hello, health champions. The kidneys are truly remarkable organs. If they fail, you could become seriously ill within a few days and could even die within a week. That's why today, I want to talk about some of the most important signs and symptoms of chronic kidney disease and kidney failure. More importantly, I want to help you understand how to recognize it in the early stages so that you never have to go down the path of kidney failure, dialysis, and kidney transplants. If you want to truly master your health by understanding how your body works, be sure to subscribe, hit the bell, and turn on all notifications so you never miss a life-saving video. I was shocked when I did some research and watched other videos on this topic that had millions of views. These videos did nothing but list some signs and symptoms that scared viewers and advised them to go see a doctor. Of course, there is a time and place to see a doctor, but if we understand the kidneys better, appreciate how amazing they are, and learn how to take care of them, we can often avoid needing to see a doctor at all. The kidneys are often described as filters, which is true, but they do much more than that. They are sensors. They sense different metabolites in the body and produce hormones to respond to those changes, helping to regulate various functions in the body. One of the things the kidneys are sensitive to and regulate is the pH of the blood. They can remove acid, base, and adjust the pH levels in the blood. The kidneys are also highly sensitive to oxygen, which we'll discuss more in a moment. Most of what the kidneys do is reabsorption. They filter the blood to push fluid through a very fine filter, but then they reabsorb most of it. The kidneys filter over 200 liters of fluid each day, but because they want to keep certain substances while removing others, they act as selective filters. They reabsorb 99% of water and all sodium, which is great at removing excess sodium. When it comes to potassium, the kidneys reabsorb 88%. Regarding glucose and amino acids, which are precious fuel and building blocks, the kidneys don't want to lose any of them, so they reabsorb 100% unless you're diabetic or your blood sugar is so high that it exceeds the reabsorption threshold, in which case glucose will be excreted in the urine. But again, this is not a normal state. The kidneys are also good at removing waste like creatinine. They remove 100% of it and don't reabsorb anything they don't need, which makes them extremely intelligent and highly selective. Now, here's where creatinine becomes useful. Since the kidneys should filter out 100% of creatinine, any remaining small amount can give us an estimate of the glomerular filtration rate, GFR, a number that tells us how well the kidneys are functioning. If the kidneys start to become obstructed, this number will decrease. Creatinine levels are influenced by muscle mass, so if you have more muscle or are highly active, it may slightly skew the numbers. On the other hand, if you have muscle loss, such as from injury or intense exercise, it can also change the number. The estimated GFR, eGFR, is usually calculated based on age, race, and sex, as everyone has slight variations. But the general point is that the eGFR is a very useful way to measure kidney function and provide clues about what's happening long before you have symptoms. There are 5 stages of chronic kidney disease, and what I've seen from other sources is that signs and symptoms are often listed as if they happen randomly or similarly across different stages. But understanding when they happen makes all the difference in knowing what to look for. In stage 1 of chronic kidney disease, the GFR is still normal, but the kidneys may have some damage. There may be infection or some kind of bacterial issue that's affecting the kidneys. You might see something abnormal in your blood or urine, but at this stage, symptoms are generally minimal or non-existent. In stage 2, we start to see a reduction in the filtration rate, to between 60 and 89 milliliters per minute. In stage 3, the GFR drops to 35 to 59, and stage 4 is 15 to 29. At this point, the kidneys are really starting to shut down, and when the GFR drops below 15, we move into stage 5, which is complete kidney failure, and dialysis or a kidney transplant becomes necessary. Now, here's the key to avoiding kidney failure: it's vital to catch kidney issues in the early stages. The eGFR is just one factor to consider. In real life, you can't just look at one marker. You have to look at the bigger picture and consider what both the liver and kidneys are doing. But let's focus on eGFR as an illustration of what's going on. In stage 1, you may not have any symptoms or very few. However, you might notice changes in your urination. If you have an infection, you might experience a burning sensation when urinating, or there may be changes in color or smell of the urine. If you notice any of these changes, and you haven't been eating asparagus recently, it could be a sign that your kidneys are having trouble. If there are changes in frequency, appearance, or if your urine becomes cloudy or foamy, that's not good. If you find protein in your urine or bacteria, that could change any of these factors. Stage 2 of chronic kidney disease is when we see the filtration rate decrease further, potentially by about 30%. You might not notice any symptoms, and many people come to my office with numbers in this range and have no idea. Interestingly, this range is considered normal in blood work. Though stage 2 is technically chronic kidney disease, it's often still within a normal reference range for people over 59 years old. But I would be cautious here, as it can indicate something is wrong, and if someone's eGFR is at 80, I'd be very careful about how I handle their kidney health. When we move into stage 3 of chronic kidney disease, this is where the real issues begin. The filtration rate drops to between 30 and 59 milliliters per minute, and symptoms start to become more frequent. Not everyone will experience them, but they become more common. You may develop high blood pressure because the kidneys are responsible for regulating blood pressure. If the kidneys aren't working well, they can't control blood pressure effectively, which leads to further damage. High blood pressure causes more strain on the kidneys, creating a vicious cycle of kidney damage. So, it's essential to understand how kidney disease progresses and how to recognize the early warning signs. Taking action early can help prevent kidney failure and improve your overall health. In stage 3 of kidney disease, anemia becomes a major concern. Here's how it happens: the kidneys sense the amount of oxygen in your blood. If there's not enough, they produce a hormone called erythropoietin, EPO, which helps create red blood cells. For example, if you go to the mountains for a few weeks, your kidneys will sense the lack of oxygen and produce more red blood cells. But if your kidneys are damaged, they can't produce enough EPO, which means you won't create enough red blood cells, and this leads to anemia. Stage 3 can also bring bone disease as a complication. Normally, bones look like healthy bone tissue, but kidney damage can affect this. There's a mineral called phosphate that needs to be balanced with calcium. The ratio between these two is more important than the actual amount of each one. When the kidneys are damaged, they can no longer remove phosphate from the blood, so phosphate builds up. To balance this, the body produces a hormone that pulls calcium from bones to counteract the high phosphate levels. This is how kidney disease can lead to osteoporosis. At stage 3, we also experience swelling, especially in the hands, feet, and around the eyes. This occurs when the kidneys are leaking protein, particularly albumin, into the urine. Albumin acts like a sponge, helping maintain the right amount of water inside the blood vessels. When albumin levels drop, the body starts losing water, which leaks into surrounding tissues and causes swelling, known as edema. Back pain is another symptom common at this stage. There are two ways this can manifest. If the pain is widespread and doesn't have a specific pattern, it's usually referred to as general back pain. However, if the pain is intense and feels like someone is stabbing you in the back and it doesn't ease, it might be a kidney stone. A kidney stone is different from other types of back pain because it won't subside no matter how you move, since the stone is like a shard of glass trying to make its way out of a tiny tube. Stage 4 of chronic kidney disease is when things get really serious. The filtration process in the kidneys slows down to only 15 to 29 milliliters per minute. The symptoms are similar to those in stage 3, but they occur more frequently and with greater intensity. Kidney damage becomes severe, and we're now in a critical condition. It's important to catch kidney disease before it reaches this point, because it's very difficult to reverse it once the kidneys are at this stage. Doctors will start preparing you for dialysis or, if you're fortunate, a kidney transplant. Stage 5 is the final stage, when kidney failure is imminent. The kidney filtration rate falls below 15 milliliters per minute, and in some cases, the kidneys may stop functioning completely. At this point, you'll begin to experience much more severe symptoms. One of the most alarming is difficulty breathing. Fluid that leaks into tissues due to edema can fill up the lungs, leading to a condition called congestive heart failure. You may also struggle with insomnia because your body becomes so toxic, and your entire nervous system starts to malfunction. A common symptom is ammonia breath, as ammonia is usually excreted through urine, but without kidney function, it's expelled through the lungs. Additionally, you may experience a metallic taste in your mouth as toxins build up in your system, and you may also experience itching, nausea, and vomiting. Your body will try to eliminate toxins in any way it can, and at this stage, it's clear that your body doesn't want to intake anything. This can lead to a loss of appetite, and muscle cramps become common due to an electrolyte imbalance because the kidneys can no longer regulate them properly. At this point, there's little you can do other than prepare for dialysis or a transplant, or face the reality of death. As you can see, kidney disease can be a bleak and frightening path. So the key question is, how can you detect kidney problems before they get to this point? The earliest sign is insulin resistance, which is closely related to kidney disease. Type 2 diabetes is the #1 cause of kidney failure because it damages the tiny blood vessels in the kidneys. These vessels are also found in the retina, which is why diabetes is the leading cause of blindness. And in the peripheral nerves, which can lead to amputations. If you want to take care of your kidneys, it's essential to understand insulin resistance and work to reverse it. If you found this video helpful, there's another one you can watch that goes deeper into this topic. Thank you so much for watching, and I'll see you in the next video.